guys, it's Gabrielle. I chose to do my presentation on embryonal cell carcinoma. So first I'm going to start with the normal anatomy of the testes. The testes are bilateral, symmetrical, ovoid glands located within the scrotum. Also within the scrotum is the spermatic cord and epididymis. The testes are considered a paired organ with the epididymis. The function of the epididymis is to store, convey, and excrete sperm. The testes contain seminiferous tubules that produce sperm. Located between the tubules are Leydig cells, which are responsible for producing testosterone and androgens. The testes are an endocrine and exocrine gland. The endocrine function is testosterone production, and the exocrine function is sperm and semen production. The testicles attain maximum size around puberty. The size of both the testis and epididymis decrease with increasing age. The normal adult testis measures 3 to 5 centimeters in length and 2 to 3 centimeters in transverse and AP diameter. So this is an image of a transverse testicle, and this is an image of the sagittal testicle. The tunica vaginalis is a peritoneal sac composed of 2 layers that cover and surround the testis and epididymis. The visceral layer is a serous membrane that produces secretions and covers the testis and epididymis. The parietal layer is the inner lining of the scrotal wall, which contains lymphatics for fluid absorption. Both visceral and parietal layers are separated by a potential space that normally contains a few milliliters of fluid. There is a small bare area not covered by the tunica vaginalis posterior. At this site, the testicle is adhered to the scrotal wall, preventing torsion. The tunica dartos is a thin layer of non-striped muscular fibers continuous around the base of the scrotum. It divides the scrotal pouch into 2 cavities for the testes, and it acts to regulate the temperature of the testicles, promoting spermatogenesis. The tunica albuginea is a fibrous sheath that covers the testis. It invaginates the posterior aspect of the testis at the hilum to become the mediastinum testis. The mediastinum testis functions as a supporting system for arteries, veins, lymphatics, and seminiferous tubules. The rete testis is a network of epithelial line channels embedded within the fibrous stroma of the mediastinum testis. They collect sperm from the seminiferous tubules and drain into the epididymis through afferent ductules for storage and maturation. The primary source of blood flow to testes is the testicular arteries, which arise from the anterior abdominal aorta just below the level of the renal arteries. So in this image here, you can see the tunica vaginalis, you can see the testis itself, the tunica dartos, and we see the epididymis. For normal sonographic appearance of the testes, in infants and children, it has a hypoechoic parenchyma. For adults, it's homogeneous with medium-level echoes with smooth contour. The echogenicity of testes should be symmetrical. The intratesticular Doppler blood flow should also be symmetrical. Testes should have low resistance, low velocity, intratesticular blood flow demonstrating continuous flow throughout diastole. So here are some images of the appearance of the normal testes. In this image, you can see the whole epididymis from head, body, and tail. Here's the testis right here. This is an image of a sagittal testicle, and this is an image of a transverse testicle. And you can see how homogeneous it is with that smooth contour. Okay, so embryonal cell carcinoma is a type of testicular cancer. It most often develops in young and middle-aged men. It tends to grow rapidly, often invading the tunica albuginea, distorting the testicular contour and spreading outside the testicle. It is classified as a non-seminoma germ cell tumor. Germ cell tumors are divided into seminomas and non-seminomas. Non-seminoma tumors are often made up of more than one type of cell and are identified according to the different cell types. Non-seminomas are more common and tend to grow more quickly than seminomas. It is the second most common type of testicular tumor after a seminoma, and is also more aggressive than seminomas. The symptoms for embryonal cell carcinoma are painless testicular mass and swelling of the testicle, and that can be with or without pain. For abnormal lab results, non-seminomas often make AFP. They can also cause HCG blood levels to rise. AFP and beta-HCG are elevated in approximately 70% of patients with embryonal cell carcinoma. In this image right here, this is what the tumor looks like. And I'm going to show you some more pictures here. So it's classified as heterogeneous with small hypoechoic mass, areas of increased echogenicity due to calcification, hemorrhage, or fibrosis. And you can see some of these little calcifications here in this picture. Let me see. You can't really see them, but they have irregular borders and they may contain cystic areas. And in this picture, you can really see those cystic areas very well. And the color and power Doppler demonstrates increased vascularity around the tumor. And you can see that in this image. These pictures are all from the same study, these three. So you can see that increased vascularity right here. So for prognosis, good prognosis, all the following must be true. The tumor is found only in the testicle or in the retroperitoneum, and the tumor has not spread to organs other than the lungs, and the levels of the tumor markers are slightly above normal. Intermediate prognosis, all the following must be true. The tumor is found in one testicle only or in the retroperitoneum, and the tumor has not spread to organs other than the lungs, and the level of any one of the tumor markers is more than slightly above normal. For poor prognosis, at least one of the following must be true. The tumor is in the center of the chest between the lungs, or the tumor has spread to organs other than the lungs, or the level of any of the tumor markers is high. For treatment options, there's surgery, radiation therapy, chemotherapy, surveillance, and high-dose chemotherapy with stem cell transplant. For differential diagnosis, teratoma, which is also a germ cell tumor, solid malignant mass, it is the second most common testicular neoplasm in children and is rare in adults. That is different from the embryonal cell carcinoma, but the appearance is very similar. It is heterogeneous, complex mass, usually cystic and or solid. It does have well-defined borders and acoustic shadowing, but the image of a teratoma looks very similar to the embryonal cell carcinoma with these cystic components here, and it does have some little calcifications as well, and it's again very heterogeneous, just like the embryonal cell carcinoma. And then the choriocarcinoma is also another germ cell tumor. It is a solid malignant mass. It is a rare tumor seen in less than 1% of patients. It is the worst prognosis of any of the germ cell tumors, with death occurring within 1 year of diagnosis. It has irregular borders and is a complex lesion. So again, very heterogeneous, and it has these little cystic areas with also some calcifications in here. Okay, and now for the quiz. So I have 4 questions for you guys. And references. Thank you.